doing this kind of things very you are intelligent person and you are very big doctor yourself. So we always respect you. About the thyroid is a very big issue at the moment in the whole world. It's so many years. People are suffering with that, like a other they call disease. They're suffering from the same thyroid system, like a blood pressure, like a diabetes, like a other heart problems, so many things. And thyroid have as two type of thyroid, underactive and overactive. But both are dangerous for the body, our system. When I got the thyroid patient nearly 6, 7 years ago, first patient come to me. I had some research on the thyroid, but that is a very bad condition. Then I done the more research on that one. What is the actually problem? Then I found in the Ayurveda, we have the detail of about the thyroid. It's very near, they call Galaganda issues. The very much similar, they call thyroid. It's the when I done the study research on that one and history of the thyroid, in the Ayurveda before BC, 1400 years ago, the BC, before the Christ, they written in the Ayurveda. Our Rishi, very famous, they call Shushrata. In Shushra Samhita, they write about they done the operations, that one. Who's the master of, or god of surgery, we say. All the universities, they know. He designed the equipment for the surgeries. They mention in the Ayurveda, and people got the problem. Same, the system is coming now, lot of improvement they done. But with the Ayurveda, what the Ayurveda said, why our thyroid gland is affected. That is the most important. Like in, you done the so many videos, and from last 2, 3 conferences, I said, there is no any disease, only our body's organs and glands reaction, which one we suffer. And what I found in that one, they say in the thyroid, they have to, the thyroid gland is actually like a manager of the system we call endocrine system. Like a liver is the manager of the body to supply blood everywhere. Metabolism and gut problem, before thyroid people affected with the thyroid, THS or T3, T4, they have those kind of issues. Thyroid glands is covered near almost every type of the glands in the body. Like I mentioned in the last videos, we have the 43 glands. They all glands covering the 78 organs of the body. Who the master of the thyroid gland? In my research, I found the pituitary gland. Pituitary gland is the supplier to every organ, every glands. He controlling that one. He not controlling that gland, not controlling himself. They give the order to thyroid gland. Why thyroid gland is become, when thyroid gland is affected, slowly, many organ of our body start suffering. In the new theories, they say metabolism is affected. I say no, metabolism is not affected by the thyroid gland. Thyroid gland is suffering because our immune system metabolism is not properly working. He not listening what thyroid want. When the message is not each other related, metabolism giving the message to the pituitary gland, and pituitary gland telling the thyroid release the hormones on these organs. Every organs need the hormones. If the hormones is slow or under or overactive, then become the problem. And this is the reason why then thyroid not listening to the pituitary gland properly. Why not doing the work properly? Because thyroid becomes sick. Why thyroid becomes sick? Because metabolism not supplying to the liver is also become the problem, that one. What I done the treatments, the people, very last stage, they're reversing their thyroid. It's very recently one patient, we can't mention her name, and that patient nearly 6-7 months ago, hospital told them they have to remove their thyroid. And when they come to see me, his thyroid is completely under control now. And I'm not giving any medicine for the thyroid. I'm not disturbing suppressing any organ. As I told before that one, we have to balance their system. I made their thyroid system's inflammation, take it out from her thyroid. That is, the thyroid is inflammation in the thyroid. That reason is not working. Same pancreas problem, same liver, same. I found so many treatments like this one. So what I found, same policy, same theory, I apply on the thyroid glands. When we done that system, become in the normal position, that one, thyroid start automatically working and listening to the pituitary gland. Pituitary gland is the main organ, main gland who make the THS level. When he tried to give some people say why they become too much high. Reason, the pituitary gland is supplying more and more, and thyroid overloaded, then he can't take it that one. Then his pituitary gland start working more fast. And when they working more fast, and then the people got in the sign of the brain fog, they not start losing their memory. And when this kind of problem comes, then he's spending his extra time on the thyroid to cure the thyroid, let him work. And thyroid is not only supply the hormones, also supplies some kind of protein, which one go into the blood and become the calcium normal and vitamin D normal. When is this all disturbed system, then everywhere it becomes the problem. Heart rate go very low, high. Skin is not proper moisture. Some people get the constipation, some people diarrhea and too much toxin staying in the body. And also many other hormones, which one thyroid should be covered, is not covering properly. People get the problem for that one. That problem make the person very upset. Then his brain become anxiety, upset, and all the time he feel like tired, because all their system, metabolism, liver, all start becoming suffering from that one. On one reason, because he is the main hormone supplier and some protein supplier to the body, and also controlling the metabolism, is controlling all the strength to giving to the body. When he is not, though both is not working, then thyroid give the problem to other organs. Digestion problems come, heart problems come, so many problems come in the body, and also genetical organs become a problem. These things are all the functions become irregular. The person's life become hell, and the allopathy say they need the thyroxine. That is the only solution. They start there, they get some relief from the thyroxine, but as every problem, medicines, I tell the people, these should take the medicine if you like, but if that medicine for the whole life, then slowly other organs start suffering. Person's life become hell, all the time scared, and later on, when thyroxine go very high dose, then they say, oh, you have to remove the thyroid. When they remove, then you have the big problem. It's not the solution of to remove that thyroid. Solution is to how can we make him workable. That is the Ayurveda treatment I do. With that one, we have very successfully treated that one. Take time. Most of time, within 4 or 5 months is medicine free. So we not give the life for permanent, for whole life to take that medicine. We treat them, the thyroid's inflammation become the normal, start working. As I said, once the problem is solved from the organ, they start automatically working, they all become settling then. There's no need to be worried too much. In the Ayurveda, we have the medicine for that one. Most of cases become very, very normal. It depends on what condition thyroid persons come to us. At the moment, we treated nearly 3 patients, which one is the same. And also, when thyroid has become problem, slowly their vertebrae has become problem. Because thyroid is standing on the spine, vertebrae. And you can ask the thyroid people if somebody have the suffering with this, and they can tell you that all people have the cervical area or spine problem. The most of them, because they also inflammation go that area and neck area and shoulder area, it all become the problem. Then people take more medicine and more you take the medicine if there are no any side effects. Side effects always damage other kind of organs, and those kind of things, if we look after that time, it's difficult. The people think difficult, but if they think for get rid of from this problem for the whole life, they have to follow the diet. Many people ring me from last time, and they are suffering. Oh, diet is this. Don't think the diet. If you damage your metabolism, thyroid is not damaged first. Our metabolism is damaged first. Our gut damaged first. Our liver damaged first. Then thyroid is suffer. So you have to cure first those things. You have to look after for that. Those things can repair the thyroid. That's my policy. That's my theory. Thyroid is automatically, it's not become the only thyroid. Genetically, people have the thyroid problem. Some they have the genetically problem in the family. They can get it. Definitely, they can get it. In the lot of chance, they can get these kind of problem. Now somebody asked me the very good question. He say, how can genetically we can get this one? Hundred years, thousands years ago, human came in the body. Where from the gout? I say, have you heard about the STD? Whole family was okay. Have you heard about the hepatitis? If one person affected, he can affect the whole family. Their children also affect them. After that, when their generation start. So you not maybe done anything. Maybe in your family, somebody have the big problem. This we can talk another one because a lot of people's we need a question and give them answer. So don't think why genetically you got it that one. Anybody, anytime, in any generation they can get it, and they can start in the family. Because if you don't do the proper treatment, then your generations also suffer, because you in your genetically you can pass on that one. So this is in the Ayurveda. If we follow the Ayurveda rules, many people may be doing, and I know. And what is my theory? I not give the medicine for the thyroid. As I told the before, any disease they call, any autoimmune disease they call, how I reverse them? I change my theory after my research. So you have to find out which organ is damaging other organ, which organ first was damaged. You have to diagnose that one. If a good physician, good Ayurveda doctor can find that one, this always start from one organ, one area in the body. Never become all the like after 5-10 years thyroid people got suffering with the thyroid. They have so many other problems. They have the back problem, they have the other urine problem, they have the infection, and the most of ladies get more this one. And there's some people have the genetically problem. Sorry to say this one, they have the no desire, no anything. Men also get this problem. They finish their desire. And also there's some people get the lot of in the private area discharge a lot of kind of this one and this kind of problem, this one. Some got the cyst in the ovary, this one. There's also, because not hormone going there to repair. Our hormones are repairing our damage inside the body. When our thyroid is not working, after metabolism and liver, thyroid suffer. After thyroid suffer, all the area, any area, which one is in our body, not every organ, everybody have the same organ, same strength, same everything. Some people have the weak spine, some people have the weak other things in the organ, kidney or this. But then if it not supply proper hormones to all the organs, then they start suffering. This is I found in my research. This is my view. That is on this theory. Maybe I know some Ayurveda practitioners also listening in this one. It's my advice to them, my suggestion to them. I can't give the advice. If they're treating any thyroid problem person, don't just only try to reverse the thyroid. Never reverse. Very, very difficult. You have to find out in the history, take the history from the patient, take the ask the question and sit down, relax, and take the blood report and find out which organ first affected. If you help, first you look after that organ, then thyroxine start giving message related again. Because all the other organs, they are related to each other, as I told. And all the hormones, glands, they are related to each other. They're not working single person. Thyroid is head of them. They are main supply to everywhere. How much hormone, which area they need, how much protein in the blood they need for the body. Otherwise, so many people get the osteoporosis. Their bone become the problem, then their spine become the problem. Then after spine become the not go the oxygen blood supply there. Then I seen that 2-3 people, their bone was crumbled. One person was, he can't sit on more than 10 minutes. His tailbone because but damage. And other person, which one we recently I done the treatment, he got nearly 10, 11 vertebra was damaged, and 7, 8 ago the disc was punctured. So reason, side effects of the medicines and the treatment not done the properly. Thyroid self can heal themselves because he supply every purpose. First, we have to find out why he become overactive or underactive. Why he become tired. I say thyroid become tired. Inflammation is there. That isn't. He gave up to supply the organ in the body. That isn't. He gave up. Then pituitary gland become the problem. Pituitary gland, then THS level gone high. Well, they gave up. They can't handle. Why don't they handle? The reason we have to find out. Just do the proper, find the proper physician in your area who can look after, who can tell you. I told you in other videos, if you want to find out the proper good physician who can understand the problem, just do it one thing. Take your report, give it to him, give him time, 15 minutes, 20 minutes, send them reports before one day, ask them. If he tell you 50% your problems, you told the thyroid you have the problems, good. But if he tell you what other problem you have, every other is symptoms. Heart rate palpitation is symptom. Itching is symptom. Voice goes funny is symptom. Metabolism not working, symptoms. Constipation is symptom. Appetite is not working is symptom. Lot of gas, bloating, they are symptom. They are not, their organ means they can't handle the digestion system. Brain is not remembering anything. Brain has got a lot of fog. It means in the brain we have something, brain no need. It can't work properly. They need the system clean. If that Ayurveda physician or any doctor, I would say, I'm respect every therapy, allopathy, homeopathy, any therapy, I always salute to them. They're doing their great job. But I work that way. That is I got the result. I never tell the patient, or tell me the whole story. I always tell the patient, just bring the report and we can see. If that any kind of Ved, Ayurveda doctor, allopathy doctor, if tell you what is going on in your body, then he knows the job. And he can reverse your thyroid and bring him workable again. So this is and everybody know what is the thyroid, there's a butterfly, this one, that one, so many people, everybody now that they can do the search. But Ayurveda have the treatment and should be Ayurveda physician should be very skilled and knowledgeable who know the job. If we don't know the job, doesn't matter any doctor. I'm saying this one. I'm clearly. If you don't know the job, don't do the job. And people, but they don't want to. Everybody their job. They maybe say try that one. Don't try. Find the good physician who can tell you what is going on in your body, what is the reason. You can see that one. That time, same time, you feel that one. Oh, that was the problem in our when we start. Then you can. It's not the difficult task. What I see, we can cure. This is curable. And if you have any questions, anything, it's like a half an hour. Always, I say half an hour we give to the our listener. So you can ask the questions. Neha ji, hello?
Yes, Dr. Singh. Would you like me to close the recording so everybody is more comfortable asking question, or recording is fine?
You can keep the recording. Maybe we have to be record what people asking and what I'm giving the answer. Better we keep the whole recording. Is better.
Sure.
But if you want, if you have any order for me, just let me know.
So before the questions start, I'm really happy to share the story that that I know about, the patient's case, the Dr. Avtar has made reference to, because surprise, surprise, it happens to be my best friend. Those of you who
yeah, you refer that case to me because she very shy. She don't want to tell anybody. But without name, you can tell. You refer that case. Okay.
I won't mention the name. I'll respect that.
Okay.
But as you all know, I found Dr. Avtar because I had problems with my partner, Michael. And then when we saw after, I think, 2 or 3 weeks, how amazing recovery my partner has with Dr. Avtar treatment, I said to my friend, like, I'm going for it. This guy needs to treat me because obviously, as everyone, I had my own issues. I was born with celiac disease. So I was working for over a few years to overcome that, even though everyone was telling me it was incurable. But just listening to Dr. Avtar when I was going for the consultation with my partner, when he was making reference to autoimmune immune diseases, I thought, that's it. He's got to treat me, which that's probably another story for another day. But when I made the decision, my friend who had a problem with a thyroid, who was told that her thyroid needs to be either removed in operation or burned, and she also suffered with a terrible back problems. She said, "Can I come?" And I said, "Cool, yeah, of course." So we both went. We both had the consultation with Dr. Avtar, and yeah, I have witnessed that now is 5 months since she started the treatment, and so did I. Most of her, apart one of the blood test results, one blood test results is like on the borderline, is there, pretty much there, but according to allopathic medicine, is just like point little bit away. But all the other blood test results are good, and her spine, her back is really good. So she's like, she's respecting it. She's still not overdoing and being very mindful of her movement and stuff. But yeah, she's like won her life on lottery, and she's much better. She also suffered with a really bad tinnitus, and I know that was cured. However, because she had investigation done on her back, she had to go through MRI scan, and interestingly, that will show you how negative effect MRI scan has on our body, that her tinnitus came back. And I know Dr. Avtar had to make more effort to heal that. I'm still waiting for updates to hear on that, but I know it's getting better, but I'm just waiting for updates on that. So yes, that case study is like my case study with my celiac story, which I'm happy to share another day. And my partner is just like, makes me look every time I talk to Dr. Avtar. He probably gets annoyed with me now, but I just say, you're my godsend, you're my gift. And I'm so grateful for you in my life. So
no, I would know her tinnitus is nearly 70% is recovered now again. And she have you seen the report, that one, that has nearly 7 vertebra was punctures.
Yes, I did see the
damage. That was
punctured,
and that reason now is nearly 75-80% his vertebra has no any more pain, and you have more circulation in the body and not feel any tired like anything before.
Oh no, she had really terrible fog mind, didn't she? She just couldn't concentrate, and she was always confused, and she couldn't sleep well, and yeah, it's just like a different person. I've got my good friend back from years ago, because we've met in
I see you are both crazy each other. Very good.
Yes, we are crazy, but we also love and cherish each other. But Dr. Avtar, would you also like me to share a little bit of research and experience that I have with a thyroid?
Yeah, okay, no problem. Yeah, you can.
Because,
yeah.
like I've mentioned, I was born celiac, so I was always on the quest, oh, how can I look after my health? And it came to the time in my life when Hashimoto started being referenced a lot to me. Because it's autoimmune disease, and I'm sure, as everyone knows, that celiac is autoimmune disease as well. And I very quickly realized that I'm heading towards to have quite serious problems with my thyroid. Luckily, that I managed to control that, and of course now under the care of Dr. Avtar, I have no worries.
Okay.
But what I have learned on my quest is that the thyroid issues are very, very often related to emotional conflicts and psychosomatic issues. What I mean by that is that we can look at the problem of thyroid on two levels. One, we all know where thyroid is allocated. So it's allocated around the chakra, throat chakra. So for those of you who have
this one, lot of people are waiting to talk. Okay. And they want to want good questions. There are so many people. Okay. And we in the next meeting we do the more. Okay. That one. Thanks very much for the feedback on that one. And thank you.
I have a question, doctor.
Yes, thank you.
Right. It's my first time I'm hearing about thyroid and thyroid gland. I don't have any idea, but I don't know if your thyroid isn't working properly, what problems you have, because personally, I have a lot of problems myself. Now, I don't know how it's related to thyroid, because I've never ever thought of thyroid as such, because I don't know what thyroid problems are. I'll tell you what my problems are basically. I've had
first, what is your name?
My name is Kirti.
Kirti, okay, Kirti, yes.
Yes. So, you are saying what you said, that before you realize you have a thyroid problem, you've got other problems like digestive system problem, liver problem, vertigo, whatever, that needs to be fixed first before you deal with thyroid. Am I right?
Yeah.
Yeah. So basically, for the last 5 years, I've been told that my digestive system has got issues, right? It's not functioning fully, but I don't seem to have much problem as such. But I've had, because I was feeling sick and so forth, so I went to the doctors, and after my endoscopy, they said my digestive system is not very good. For past 25 years, I've had 3 problems in my spine, 3 compression. I've got a back problem. I've got a digestive problem, and I'm getting vertigo problem. So do you think it's related to thyroid?
This is, you said nearly 7, 8 problems you said.
Yeah.
But as only gut problem have maybe 10 type of gut problems. We don't know what kind of the gut problem you have. And as I mentioned in the thyroid, what is my theory is completely different than what the system saying. I said, first we have the other problem. Thyroid is only supplier the hormones and protein in our blood. When it's not provide that one, why not provide? Because the thyroid is suffering when it starts suffering that one. Why is suffering? Because other organs, our body, they're suffering first. Like you say, you have the gut problem, you have other problem. Maybe you start from the gut problem only.
Yeah.
And gut and brain are very much related.
Okay. Yeah.
Everybody know.
I know that.
Brain work together. In a brain, pituitary gland is there. If that one is not giving proper instruction to the thyroid, then thyroid is not supply the proper hormones to the body. Gut problem is also coming because not get the enough hormones inside. not enzyme they're getting there, not getting proper protein, not, I don't know what kind of gut problem you have. What kind of gut problem can you want to mention?
From
Don't be shy.
No, I'm not shy. It's just that obviously my last report said that it could be related to some. Now they're not 100%, but they say it could be related to Crohn's disease, right?
Yeah, Crohn's disease. Use Crohn's disease also not one or two type. As one thing, Kirti, maybe when the question come, the answer become maybe, mean they are not sure.
But there is a problem in my gut because
no, I'm not saying. Let me finish. When your examiner say maybe, I don't believe that's what in Ayurveda. In my history, in my treatment, maybe word I don't like. You should be sure. If they may be and giving you the wrong medicine, you suffer then. That is the reason whole world is suffering nowadays.
Yeah.
99%, I'm sorry to say this one, at least 90% doctor, physicians, they working on the maybe theory. When you work on the maybe theory, if I give you the example, you made the dish in your in the kitchen. I'm sure you're doing something, cooking.
Yeah.
And you see it's not looks nice color. And then you say, oh, maybe chili is less, maybe salt is less, maybe something. Can you make that taste better?
You can if we taste it. We know what.
No. So that is if you not tested properly.
Yeah.
Then you put the little salt looks better, put the little more chili, look more healthy inside turmeric. No, our body is like a more difficult to handle system.
Yeah.
It's not easy. This is 78 organ, 43 glands. This one also has so many other things to handle. People are nowadays want everything easy and online.
Yes.
On the WhatsApp, on Google, they're going this one, and so many people. As I mentioned this one, go to the doctor, which one know the job. They can give you the result within 2 weeks.
I've got basically a lot of issues. Like I said, right? I've got osteoporosis, I've got back problem, I've got digestive problem, I've got vertigo.
Together.
So if I come to you, right, I need to be sorted out from, starting from one problem. So I don't know.
No problem, Kirti. I as I'm telling again, I told so many times, with my medicine, if you don't feel better, if your body is 50% problem, you can start feeling better within 2 weeks to 4 weeks. If you don't feel better, then I say my patient, sorry, I don't think so I can handle. I'm not waste patient's time. And you go anywhere, I don't know where you live.
I live in Leicester, actually.
Yeah, Leicester, doesn't matter. You can, if you want to find out in that area, doesn't matter. I treat in the other countries, Canada, America, and everything. I do the online consultation too, okay? And send the medicine to the India and everywhere. And that's not the big problem. I don't need to be patient always come to me, okay? Some cases I have to see. Some cases I don't need to see. Like I mentioned in the third, I think before 2 video, there's one case I done nearly 99 plus that lady that had so many issues. And I not been to see, I seen that one, that lady's, his daughter is 78. And then if he call me there, then cost them a lot.
I mean, I can come to London if you live in London, because I often come to London. I don't mind coming down.
In the London, if you come to my clinic, then it's very good, that one. But it should be diagnosed. If you know the job, if you provide me all your report and your blood report, what I need, okay, then I can tell you, I don't think so any problem which one is not curable through the Ayurveda. If you damage too much already, your body, but we can still make your life livable.
Yeah.
Healthy life. You understand? But how old are you?
I'm 68.
68. Okay. You understand? If you damage too much,
Mm-hmm.
they still can come the cure, maybe take long time, but within 1 month, you can feel, yes, I am better than before.
Yes.
And slowly, all my diabetic patient took 4 months to cure. Other blood pressure, some people within first week, I think some patient, my patient also listening that one, but they don't want to become, they want to listen my lectures. And they've seen that 217 blood pressure come within 1 week. I'm treating at the moment one patient. I can't mention his name. And maybe his wife or they are listening. If they want, they can come forward. Okay, if they don't, that's okay. But their blood pressure and diabetes within 2 weeks under control. But they follow my instruction very, very, very well. Like Ila's partner, they follow my instruction. That other lady, thyroid person, they follow my instruction like a Bible. If you follow, if you have that in the mind, no, it doesn't matter allopathy, we can eat everything. No, we have to be diet and medicine and all the things what we design, you have to follow. Then I'm sure you can get the benefit from my Ayurveda.
Okay. So, you will leave your number, won't you?
Yeah, you can take my number on the group they have. Okay.
Yeah. I have put your mobile number on the chat. So please look at the chat. I put the link to the website, to Dr. Avtar Instagram account and the mobile number as well.
Yes. Thank you.
Thank you, Ila. You're doing good job. So, anybody else have any question? Nehaji? Hello. So this is the thanks, Kirti. You asked the good question about your health and what I told you. If you can do, if you need, you have to be send me the ring me, okay?
Okay.
And any other problem like thyroid related, thyroid is need to be handled. What is the reason thyroid become the inflammation? Okay.
Hello.
That one you needed that one. There so many reasons, hundreds of reasons that could come.
Hello.
Hello, yes.
ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਜੀ।
ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਜੀ।
ਹਰਮਿੰਦਰ ਹੈ?
ਜੀ ਹਰਮਿੰਦਰ ਜੀ, ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ।
ਹਾਂਜੀ। I have like multiple issues as well, health issues.
Yeah, all big people have like this one.
Yeah, diabetic and spine issues and uterus prolapse. So I just want to know, how would I get consultation and what is your charges, etc. please?
Yeah, you can ring me. You got the number. Ila just put the number on there. Okay, you can take the number or you can ring me. Okay.
Okay. Because one of my friends, she is suffering with the knee pain and blood pressure. Do you think I should give her number as well?
Yeah, if they want, as I told this one.
Yeah, she is 78.
Doesn't matter what age this one. The age is just numbers, as the people saying.
Okay.
Our body is very strong. Like I have the one patient only. She born 8th of August 1924.
Okay.
And I treated that one. And when I took the case, we have the breast cancer.
Oh, okay.
Cancer, rheumatoid arthritis, thyroid, blood pressure is 217, 15 something like this one. And kidneys.
Oh my God.
On stage 3. Her creatinine was 167 and GFR was 28. If you know about the kidney people, if they come under the 20, they still put them dialysis. And she can't walk, rheumatoid arthritis. And Alzheimer, she was suffering from 15 years.
Okay.
And Canadian Health Authority, in the last year, they told them, sorry, we can't do any more treatment. We can't do the chemotherapy or can't give that drug on anymore. So life should be 4 to 6 months. And I got that case when 5 months already was gone. And 1 month left.
But roughly, what is your consultation fee? She will ask him because she spends so much money.
Ring me on you got that, take the telephone number. Where do you live?
I live in Hounslow.
Oh, yeah, they're not very far. You ring me from there. So I'm telling you, just take 1 minute. And some my other patient recommend my name. I have the nearly 15 videos. She walking without the stick.
Oh, wow.
And she is writing. She painting with the hands. Wow. It is 50 years. And she also have the thyroid. Thyroid have come under normal completely. Her kidney become the normal. Her GFR become 45. And creatinine become 98. And blood pressure never gone more than 130, 135 after my medicine. I've treated so many patients of the blood pressure. And this is her cancer was gone too far. And that age. And also her hemoglobin was, when I took the case, 7.2. And with my medicine treatment, gone to 111. 112.
Good.
So this is all the reports we have, all the videos we have, and she doing the working in the kitchen with her daughter. She painting, she playing bingos, she answering with me, she talking with me. After 2 months, her Alzheimer's started reversing. After 15 years, we treated 2 people. I have the testimony with the other people. I done the other people, but they don't want to come forward. But 2 people, they made the videos and everything. So Ayurveda can do it, but if somebody know the job, what is the reason of this problem? So many problems when you have in the body, so physician should decide which kind of the give the body to where they can repair first, then start working on other organs. Our organs are related to each other, working with each other, not single. Our body is not single organ is working. All organs and glands are working together. That's called our body system. So you have so many things. Okay, if you think you want to
Thank you.
Take the telephone and ring me, please. You're most welcome.
Dr. Avtar?
Hello.
Thank you.
Yes.
There's a question on a chat from Vimla, who says, I developed thyroid problems after my hernia operation last year. Any connection, please? Thanks.
Which kind of hernia she have?
There's no information. Vimla, would you like to come on and give Dr. Avtar more information?
There's so many places in our body, they have the hernias.
Vimla? I hope I pronounce your name correctly.
Yeah, she got the problem, then honey, she understand. Maybe
it was in my tummy.
Oh, in your tummy. That is, you got the metabolism is related. That's when, okay, digestion system is related. So how long you suffer for the hernia?
For about 3 years, I think.
3 years. Then they start on that time, or when they done after the operation?
It started after the operation.
Operation. You was on the medication?
No.
So if the medication, then had they checked that one?
They said you are in borderline. So what I started doing was I started taking iodized salt and taking walnut oil with my salads and eating walnuts. So
you are on the borderline of the thyroid, eh?
Yes.
So who told you take it these things?
I just read about it and I started.
Where from you read it?
On internet.
Well, this is the problem.
And NHS helpline as well.
It doesn't matter. NHS, if the NHS can cure the thyroid, then all people was cured. Have you heard the NHS giving the medicine? Sorry, this hard word. Is billion patients are suffering in the whole world.
Yeah.
And have you heard anybody say, "Oh, my thyroxine is medicine is reduced," or "My thyroid has become okay"?
No, because it took them long time to even
I understand.
diagnose.
Simple question. We have to understand now. Your name is Bimla.
Yeah.
I always say you have to be understand what you taking. Take the side effects, read the side effects, go to the proper professional person, and give them only 2 weeks.
Okay.
If within 2 to 4 weeks he can't do anything, then change the physician.
Okay.
This is if you want to save yourself, this is the big problem. When a big problem come, then person say, what can I do now? I know the medicine is in this country is some free or little money, but the treatment, this one is not the easy. Why they come? They should have, maybe you have some other problems. How old are you?
I'll be 75 in December.
75 with this. Maybe other hormone problem you have, other things, okay? This is the reason that is underactive or overactive, they say?
Underactive.
Underactive. So what is the THS now?
I can't remember that. It was some time ago.
Okay, no problem. For if you want, I do something, I need the proper report from them, okay? And secondly, I tell everybody, please don't follow the internet or YouTube or Instagram, that one. If you follow that one, go. If you like that one, maybe many people are good. I have my treatment put it on that one. But don't give more than 2 weeks to 4 weeks.
Okay.
If you just keep remember this one, you understand? If that medicine is not working, that thing giving you problem, stop immediately.
Okay.
If somebody giving you medicine, oh, I can do it. Okay, thank you very much. Give him 2 weeks. 4 weeks give to the cancer patients.
Right.
I tell the people of cancer and kidney patient, if you are cancer have not any benefit from my medicine within 4 weeks, then you take anything what you want, that one. I treated so many cancer patients, but within first or second week, people start feeling better.
Okay.
This should be. There's so many people like me. I'm not saying I'm the best in the world, okay? I am also doing my job, but people should have to be ready and understand, educate themselves.
Okay. Yeah.
Only education. Okay? Okay. Thank you very much. You're welcome.
Thank you.
You're welcome. Hello?
Hello.
Yes?
Yeah. Isn't most of the health issues related to stress and hereditary?
What?
Isn't the most of the health issues related to stress? It comes due to stress.
Stress is also symptom. What is your name? First, you tell me the name.
Alpha.
Alpha.
Yeah.
Alpha. Stress is also not any disease. That is symptom. I don't know why you're getting stressed.
Work.
Yeah. There's so many issues. No need to explain on your telephone. But you have to handle that one. But if you take long time stress, that one, then you become another health issue. I don't know how long you have the stress. The stress, if they can't handle, then you need the medicine. But many people can handle their stress themselves.
No,
they have to sit down.
What I'm saying is, a lot of the health issues, a lot of the diseases you get is due to stress, isn't it?
That maybe that is possible. Definitely, when you are stressed, your brain is not helping you properly, and your glands are not working properly, then organs start suffering. If you're not sleeping properly, if you're not resting properly, if your mind is not settled, you're not resting mentally, then definitely your body starts suffering.
Yeah.
This is the big problem. Like before, the patient he gone to the so many on the internet or this one. Internet don't know your stress. What is the reason of your problem? You need to be somebody to discuss with the professional. I got this problem, or you can ask in your family if somebody elder in your family, I don't know, somebody your good friend, he can give you some suggestion why you have stress. Okay, and either if you want to contact me, you can take.
No, I don't have any stress. I'm just having a conversation. I don't have stress.
Or if
Thank
you
God.
don't have the stress, then is you don't have the experience why the problems come. That is one of the reason. Definitely with the stress you can get so many problems.
Okay.
Okay,
So,
system become disturbed. Okay.
Yeah. So, what are the foods to avoid for underactive thyroid?
What food that avoid?
To avoid, yes.
Yeah, first we have to be find out why the underactive thyroid is not working. Is with the metabolism, some stress, some kind of the shock in the family, some kind of other hormone is not enough. Okay. Calcium is not enough. First, we can't recommend on the just only eat the simple thing, take your metabolism and digestion system properly, and what stage of the that thyroid underactive. There's not, if there no any other issue, if you look after your digestion system, system, then you can reverse that one. But not the case that one what you're telling me. If something they have the thyroid underactive, they have the multi issues in the body.
Okay.
Maybe constipation. I can't give you the one diet who make the the lose motion or something. So first you that need to, how long she have or he have?
8 years.
Yeah, 8 years mean they have a lot of other problems too. You can't say only one thing is the issue. Okay.
Yeah. Okay.
So this is you do the proper information, give the proper information, then is better. Okay.
So when you say to get proper information and blood tests, is that from the doctor or from where?
Doesn't matter. You can take the blood test from anywhere. You can go to on the internet and you can, there are so many private lab. Okay. And you can tell your doctor, they can give you, maybe you already have that one. That's not the, I don't have my own lab. Okay. I tell my patient, go anywhere you want. Okay. And if you want something, we can send the most of my patients, they use that lab. Okay. And we can send you what kind of test you need. We can send you if you contact us. Okay.
Okay. Thank you.
You're welcome.
I'm sure there are many questions, but we'll continue because I'm conscious of Dr. Singh's time as well. Just before we all go, I would like to just ask quickly, anybody has thoughts for the next week or would like to suggest what you would like to cover?
Hello.
Yes. Yes.
My name is Veena. I just want to find out because I got osteoarthritis, and recently I'm suffering a lot.
Yes.
So I don't know what should I do. They gave me the medicine, which is a painkiller. Which
they have only painkiller. Your name is
Veena.
Veena. Veena. How old are you?
I'm 72.
You was on the hormone replacement therapy?
No. Actually, because I got osteoporosis,
what age?
Osteopenia, and osteoarthritis. So I'm taking vitamin D3 tablets.
I understand. I
and,
say you got this problem.
And another one which is once a week is called
How long you have this problem?
Since I think last year.
Yes. Oh, last year only, eh?
Or maybe beginning of the year, or I had a blood test, I think end of last year, and they told me that
are you on any medication, other medication?
No, only vitamin D3 and risdronate, and doctor gave me, because I am suffering a lot with the pain, recently, so doctor gave me 2 They said take 4 times 2 paracetamol with the codeine.
Veena, I am asking other question. When you got this problem, before that one, you have any medication? You taking any medication?
I was taking alendronic acid, which
for?
was once a week for because my bone was thinning.
Yeah,
bones was.
that is I asked that one. And one other thing, have you taken the vaccines?
Sorry?
COVID vaccines.
Sorry, I didn't quite get you.
Say you taken COVID vaccines?
No.
You're not taken. That's good.
No,
okay.
No.
And there's in your family you have the problem?
Yes, my mom's and my 2 other sisters got osteoporosis as well.
Yeah, this is genetically.
Yes.
Mostly genetically people start age of 50, 55 if they genetically, this. But you are lucky, you very late. Maybe you're looking after your health or diet is very good. Okay, you take. So that isn't very long. And if you have genetically, there's some other things maybe. What is the level of that one? They say your vitamin D is very low.
Yeah, because they said, I don't know, because my bones were thinning and...
No, you're not giving me answer. The bone, they need a special protein go with the blood to the bone. Okay, that's it. I say vitamin D is low.
Maybe. That's why they...
Is not the answer. You have to check the report. Okay, unnecessary you taking that one, they give you the side effects. This is the biggest problem. Our people, they just, if they got some problem, a lot of friends, they become doctor, become very nice doctors. Okay, every friend become doctor.
Yes.
Without any certificate, without any experience, they start giving the suggestion, oh, take the vitamin D, take the vitamin B, take multivitamin. Those are the all synthetic, number one. And also they build up in your body, then your body is toxified too much, and then you start other problems.
Yeah, but these two prescribed medicine, which is vitamin D3, doctor told me to take it twice a day. And then after a couple of years, they told me only once a day. And then in 2021, I had a fall and I broke my left wrist. And then they put me again that I have to take twice a day.
Why your doctor prescribe the vitamin D? I asked you, have they checked that one or not?
Okay, I can check it.
Yeah, but in your blood report should be checked. If the vitamin D is not low, then it's also a big problem.
Okay, because I'm going for my blood test tomorrow.
That's very good. Tell your doctor, they definitely check your vitamin D, vitamin B. And also if they can check it, one CRP level, okay?
Okay.
Tell your doctor CRP level and ferritin level, okay?
All right.
Now, if you check that one, then you
can... And what's the other one you say?
CRP and ferritin.
Okay, all right.
Okay? And if you check that one, then you can find what is actually going on in your body, okay? And if you can, one other thing, you check your hormones, okay?
All right, okay.
Hormones is also very important, okay?
All right, okay.
Thank you very much. You are welcome.
Thanks for your answer. Thank you.
Welcome. No problem.
Thank you, Dr. Singh.
Thank you very much. Thank you, Captain.
Just one quick question that is on the chat, and I'm sure it will be very quick answer from Dr. Avtar, is that do men also have thyroid issues?
Yeah.
Thank you. I knew it would be a quick one.
No, I told you that one man is, but you know now that one man, which one is, I never seen the problem. His whole vertebra was, he can't even turn when he sleep. Thyroid can make the spine very big issue, and other he can't digest. Very big problem. Thyroid can come on most of the, you can say 70% women and 30% men. Okay.
Yeah, that's all the questions from the chat.
Not only women, men also get this kind of these things. Okay.
Okay.
Well, yeah.
That's all the questions from the chat. So
thank you very much. Thank you very much. Thank you, Neha ji.
Thank you, Dr. Singh, and thank you, everybody. See you
Thank
all
you.
very next week.
Thanks
Thank
to you.
you.
Okay, thank you very much. Have you done the record, this one fully?
Yes, I haven't stopped yet. So
okay, don't
yes,
wait. Last week recording, you put it on the...
Yes, I will share. It's all in the playlist. Yes.
Okay, darling. Okay, thank you very much. Thank you. Take care, please, okay?
Thank you, Dr. And thank you, Naji.
Thank you.
Thank you, Dr.